The relationship between CPAP therapy and hearing health in sleep apnea patients is complex and still not fully understood. Recent research reveals that after 6 months of consistent treatment with continuous positive airway pressure, CPAP, most patients with moderate to severe obstructive sleep apnea, OSA, do not show significant improvements in hearing thresholds. But here's where it gets interesting. Adherence to the therapy appears to play a crucial role in preserving cochlear function, the part of the inner ear responsible for hearing. Obstructive sleep apnea has long been associated with an increased risk of sensorineural hearing loss, a type of hearing impairment caused by damage to the inner ear's sensory cells. Previous studies have suggested that OSA might harm the outer hair cells of the cochlea, potentially through mechanisms like oxygen deprivation or oxidative stress. However, until now, the exact impact of CPAP therapy on the inner ear's health remain unclear. In this recent study, researchers followed 42 patients diagnosed with OSA. Each participant underwent comprehensive hearing tests before starting CPAP treatment and again after 6 months. These tests included pure tone audiometry, which measures hearing sensitivity at various frequencies, and otoacoustic emissions tests, specifically transient evoke, TEOAE, and distortion product, DPOAE, which evaluate cochlear function directly. Throughout the study, adherence to CPAP was carefully monitored. The findings showed that, on average, there was no notable shift in hearing thresholds across different frequencies after 6 months of therapy. Similarly, the otoacoustic emission signals, which reflect outer hair cell health, remain unchanged at all frequencies. This suggests that, in general, CPAP therapy does not seem to cause improvements or deterioration in hearing sensitivity over this period. However, the story becomes more nuanced when players' adherence to treatment is considered. About 69% of participants use CPAP regularly. Interestingly, those with better compliance exhibited higher signal-to-noise ratios, SNR, a measure of cochlear function, in both TEOAE and DPOAE tests, especially at frequencies around 1000 Hz, 2000 Hz, 6000 Hz, and above. This indicates that consistent use of CPAP might help protect or maintain healthier cochlear cells, possibly by improving oxygen levels in the inner ear and reducing oxidative stress, a key factor believed to cause damage during hypoxic episodes associated with sleep apnea. The researchers noted that these findings could mean that diligent treatment with CPAP might serve a protective function for the inner ear, helping to slow or prevent cochlear damage triggered by episodes of low oxygen during sleep. Conversely, individuals who fail to adhere regularly to their therapy might not experience these benefits, highlighting the importance of compliance for overall ear health. This study invites a broader discussion about how we view the benefits of CPAP therapy beyond managing sleep apnea symptoms. Could it also be a tool for preserving hearing? Or does this research challenge the assumption that CPAP has no impact on cochlear health? The debate is open, and one thing is clear: consistent treatment adherence might be more vital than many realize in safeguarding our inner ear from the silent damage associated with sleep apnea. What do you think? Should hearing preservation become a key reason to commit to CPAP therapy, or are these findings enough to question its role? Share your thoughts below.